The Public Accounts Committee has continued to scrutinize the Auditor General's report for the financial year 2024-2025. The officials from Kiruddu Hospital familiarized the MPs on Park Central about the operations of the 200-bed capacity hospital.
We are just going to take note of the budget that we receive. However, we are just going to go direct to the review of dialysis treatment in Kiruddu, because that is your basic mandate.
In the Auditor General's report, several shortcomings were noted that have stalled operations at the facility, including high costs of dialysis treatment, understaffing of critical units, lack of isolation facilities for infectious diseases, and long waiting times to access services.
In total, in a day, we do about 60 sessions. So it's not like all the 60 patients come at once.
Definitely.
So 20 come, dialyze them, they go. Another 20 come, dialyze them, they go.
The hospital executive director, Dr. Charles Kabugo, reminded the committee that Kampala Capital City Authority has since remained with the land title of Kiruddu Hospital, despite its breakup from the management of the facility.
And we know the risks, and unfortunately, it has even hampered our own progress, because many times when you want to construct something, like recently I wanted to construct a maintenance store where we can maintain our equipment. We had to go to KCC to get approval for the plan, and they rejected our plan because they said, we don't have ownership of this land.
Kabugo says KCCA also holds some funding for the sewage plant, which was solicited during its tenure. The hospital authorities want to expand the facility, having advanced plans to acquire more land in the neighborhood.
So, colleagues had a proposal of why don't we shift Kiruddu from where it is to some other space such that we can provide better services that you cannot, but also aware of the presidential statements or the president's statements of having Kiruddu downsized to a general hospital. You also have to think about that.
Kiruddu Hospital registers more patients in need of services, including dialysis treatment and endoscopy tests.
With this continued dialysis that seem not to be cost effective on the side of the patients, and the treatment seem to be high, the auditor says the continued dependence of dialysis has created an increasing fiscal burden on government and the hospital, which must continually procure consumables and maintain equipment for service that offers only temporary relief.
I think what they're trying to bring out here is that government should put more resources in building capacity for the kidney transplant, because that is the final exit. Whether you're on dialysis or not, the final exit out of the program is kidney transplant. Kidney transplant is also, dialysis is also very important for those who have got what we call acute kidney injury, the injury of the kidney that is going to recover by itself.
In the year in review, Kiruddu Hospital had an approved budget of Uganda shillings 28.62 billion and collected 972.98 million non-tax revenue. However, the hospital is understaffed. Its intensive care unit has 14 nurses instead of the required 24.
The staffing we have as of now, like I said, the structure that is approved is 830, about 840 that is approved. But this has only been populated up to about 30%. So we have about 280, 290, as of now we have 290 staff.
The hospital was designed for a different medical status, but was turned into a referral hospital. Daniel Mugoya, Gloria Gutabinji, UBC News.